There is a strong chance you or someone you know will have a heart attack. Two of the most common surgeries performed today are angioplasty and coronary bypass. In today's Living Well with Dr. Sam, Naturopathic Medical Director Sam Walters, founder of WellSpring Clinic, is back to talk about how he can help you clean your arteries safely and naturally. That's the key for me, the word naturally. And
yes,
so
that's what people want. They want natural if it's applicable. In this case, it is.
So what happens when our arteries are clogged?
Well, here's a kind of a little cross-section of a normal open blood vessel.
That's a good blood vessel.
You can see it's nice and open. And here's what it looks like as we get a little bit older. You can see how it clogs up. That narrows the opening down so you don't get much blood supply through there. So the heart has to enlarge to squeeze more blood. Next thing you know, we have kidneys that are shutting down, heart shutting down, then we're on blood pressure medications, then other medications, and pretty soon it gets carried away.
Well, this was really shocking to me because you were saying 50% of the people who suffer a heart attack will do it again?
Yes, at least 50% of the people who have a heart attack will probably end up dying from that. Matter of fact, about 55% of the people die from a cardiovascular event in this country every year. I mean, either that or cancer, and the majority of them is a cardiovascular event. And there are natural things we can do to really clean that out.
So WellSpring Clinic offers what's called Ptx Therapy. What is that and how does it work?
Ptx Therapy is something I learned in Switzerland. They've been doing it for about 50 years now. And what it is, it's a natural substance taken out of soy. It's called phosphatidylcholine. By the way, phosphatidylcholine is the substance that carries cholesterol throughout the body. So anything that carries and dumps in the body, it can pick it up and carry it out. And that's what it does. It softens up the plaque, carries it out. You get circulation all over your body again, and it's really a spectacular therapy.
And I know we had a graphic up just a few minutes ago. If we can go back to that, what are we looking at in that image? What are we seeing as far as our arteries go?
That's a kind of a cross-section of an artery, and that yellow represents the plaque and how it bulges out and can create aneurysms and strokes and heart attacks. And that's what happens to us as we get older. We just kind of plug up.
So what happens? So what does the therapy do for our bodies as far as that yellow glob of plaque?
That IV therapy, it dissolves that, cleans it out of the body, and you get circulation again all over the body.
So what are patients? I mean, does it do more than just?
Oh yeah, matter of fact, a high percent of your brain is made of that. So we use it with, if we can get to an Alzheimer's patient in time when it's first beginning, we've had great success in stopping it. Almost every neurological disease from MS respond to this.
So does it slow the progression? Obviously you said Alzheimer's, what else?
Almost any neurological ailment, Alzheimer's. I've had great results with ALS of all things, and that's a tough one.
All right, so let's walk through really quickly. A patient comes in to see you. They are maybe having stiffness in the chest and not feeling so great. You do a test on them?
Yeah, sure. We'll do EKGs, we'll do MRIs and CAT scans if we have to. One of the things that we do is an ultrasound to see if you are plaqued up. We identify where it is, how bad it is, how thick it is. Then we go to work clean it out. Then after so many IV therapies, we redo the ultrasound, and lo and behold, it is disappearing in a big way.
So the big question, how long after I come in for that initial appointment, you put me on the therapy, and I come back, am I seeing results?
We do about 20 IV infusions, and then we redo the test to see if how much we've cleaned out and where you are with it. By that time, you've also noticed a big difference. You don't have leg cramps anymore. You can walk and play golf and do things you couldn't do before.
And when I can only imagine that patients, you've saved lives with this.
Oh, we do save lives. We save a lot of lives. It's something everybody should look at. Don't wait till you have that cardiovascular event. Get the test, find out if you need this. It's simple, it's safe. It couldn't hurt a baby with it.
Right. Well, when we talked at the top of the segment, I said you or someone you know is likely going to have a heart attack. This is very dear to you. You've lost some folks to heart issues.
I've lost folks to heart attacks. At this point right now, we've saved 18 lives this year since last January by doing a special MRI and some other testing. We're pretty proud of that. My goal was to save 50. We're at 18. I don't think we're going to make the 50, but with the technology we have in this day and age, there isn't any reason for people to die of cardiovascular events.
But it's happening more and more.
More and more. Almost every degenerative inflammatory disease is up 200-300% in the last 30-40 years. And a lot of it's our diet, lifestyle,
right?
But we have answers. So it's about prevention. That's the motto in our clinic. Prevention is the cure.
All right, well, if you would like to get some prevention to keep this from happening to you, WellSpring Clinic does have a special offer for you today. If you give them a call, you will receive half off an initial consultation exam with Dr. Sam. That is a $105 value. Plus, with a paid scheduled appointment, you will receive a free bottle of the Ptx Sustain supplement. WellSpring Clinic is located at 8070 East Morgan Trail, Suite 200 in Scottsdale. To schedule an appointment today, call Dr. Sam's office at 480-946-9222 or visit their website, wellspringclinic.com.